Mentiase TV. Keep on watching Mentiase TV.
Shall we all please close our eyes as we pray? Dear God, we thank you for today. We thank you for our lives. We thank you that you have made this conference a reality. We thank you for our facilitators that you have brought from far and wide. Thank you for all the participants here today. We pray committing this conference into your hands, that you make it a success in Jesus' name. Amen. We pray that for the purpose that we are here, that we are gathered here today, will be accomplished in the name of Jesus. And we pray that at the end of this conference, we will get all the knowledge and understanding that we need to be future doctors, good doctors in the society. We thank you and we ask, Lord, that you will be with us throughout the whole conference. And at the end of the day, we'll give you all the glory that you deserve. In Jesus' name I pray. Amen.
Slava Ukraini.
Wow, guys, come on. I'm Dr. Kailan and this is Dr. Phoebe. And we are very honored to be your hosts for this opening ceremony.
The first step to achievement is desire.
Which is what we see in you guys today. The desire and passion to be better physicians, better doctors, better medical students. You see, medical conferences are something that provide a boost, a step up through your medical journey. Because without this, a lot of us feel left behind. A lot of us feel that we can't really, become complete physicians. So this conference is giving you an opportunity. And we recognize that you value your future, which is why all of you are here today. Because you want to be better.
And we see, and we are sure that this conference is going to give you an opportunity, not just to learn better skills, not just to become better physicians, but to meet a like-minded community of people like yourselves, to make wonderful connections and to have an overall great time. And so, as Zig Ziglar once said, the elevator to success may be out of order, but the stairs will always be in service.
Which means work hard. I just want to mention that without some notable people, this conference would not have been possible. Namely, we have
the Helpline and International Organization, most notably HMI USA, HMI Ukraine, and HMI Durham.
the doctors who traveled from so far away to be a part of it.
We also like to recognize our partners, the Ivan Franco's National Medical University, as well as some very important dignitaries that are not able to be here in completion, but we'd like to recognize their presence and their support.
Namely, the Vice Rector, Dr. Hannah Atsenyu, the Medical Faculty, Dr. Roman Yatsishin, the Dean of Foreign Students Faculty, Dr. Dimitru Solomchuk, the Vice Dean of Foreign Students Faculty, Dr. Marian Voloshinovich, and Dr. Andrei Travinsky.
We'd also like to recognize Dr. Andriy Protsik, Dr. Pavlo, Dr. Bogdan Vaseva, Mr. Holly Bolgina, and Dr. Halina Hihon. Not forgetting, we'd like to recognize the support of our sponsors, without which this conference will not be holding. We'd also like to recognize our wonderful friends, our colleagues, and our beautiful participants. There will be no conference without you.
And the chairman of the HMI Advisory Board, please give us a hand. Including...
How old were you October 1995? Okay, wait a minute. So, was anybody here in 1995? Okay. Well, October the 22nd, 1995, I landed in Kiev for the first time. So, I didn't know what I was going to say tonight, but I'm just kind of making this up. So, but I thought at that time I'd been invited to be a part of a medical conference. And it was 7 or 8 doctors. We spoke at an institute, and I thought, okay, it'll be a nice trip. It's 1995. Ukraine's been independent for 4 years. Chernobyl was 9 years ago. I need to go visit this place, thinking I'm going to visit it twice. My first time and my last time all in one trip. I thought, that's it. Well, a long story, very, very short, is I made friends with some ophthalmologists in central Ukraine and got to know them, had a relationship with them over a couple of days, and decided, well, you know, I might need to come back next year, and there's some things that we can do together to make their practice better, and we can collaborate. And so the second trip happened, and then the third trip happened, and I met more people and more friendships and more relationships and more opportunities happened. And I landed, when did we land? We landed Monday, 26 years later. That was the 47th time I've landed in Kiev. My point is, my first trip that I thought was going to be my one and only trip turned out to be much more than what I've anticipated. I would never have thought I would stand in a room in 2021 with a room full of people who hadn't been born yet, and who are eventually going to be, and I'll be one of these days I'll be able to say I'm going to be a very proud colleague of each and every one of you in this room. These beautiful young ladies here, future physicians, they said it well. You're here because you want to be here. Nobody forced you to be here. It's all about effort. I want to say just a couple more things, and then we've got lots of people for you to introduce and lots of great people here tonight. But the first year we call this Becoming a Great Physician, the Christ Factor. The Bible portrays Jesus as the great physician. No better model for us to model our life and our career after. And I always made the big deal about what's the difference between a doctor and a physician. In the English language, we have those two phrases. And doctor means you take all the tests, you study from all the books, you pass the exams, somebody crowns you doctor, they put a white coat on you, and the life is good. You've accomplished. No, you haven't. You've become a doctor, but that's it. And I think what's more important is not becoming a doctor, becoming a physician. And in my mind, that takes the knowledge that you have and the anointing of being a doctor and applying it to all mankind. It's no more complicated than that. So I've said 3 things, and I've been going over this year after year after year. But these have become kind of the passion of my 3 things. Were any of you here at the first conference? Okay. Well, I'm not going to recreate that, but that night I took off my coat, and I put on a white coat, and I pulled out a stethoscope, and I said, can anybody tell me who invented the stethoscope? Nobody knew. But what I said is, we'll listen to the heart, we'll listen to the lungs, we'll listen to the bowel sounds, we'll listen to the neck, we'll listen for bruise, we do all that kind of stuff. And we hear all those things through those 2 little pieces under here and that one little bell there. But I tell you, if you want to be, a doctor will do that. If you want to become a physician, you have to learn how to listen with your heart. And what I mean by that is, you listen to the patient, you look at them, you treat them as an equal. You're not arrogant, you're humble, okay? That's the way it is. So you hear with your ears, you listen with your heart. The second thing is I held up a pen light, and I said, we look in eyes, we look in ears, we look in throats, we look at every part of the body possible with a light. So it says, you can see with your eyes, but you have to have a vision of being a servant. And if you want to be not only a doctor, but a great physician, you want to be a servant. You want to have a vision of being a servant. You serve the person that sits in front of you. You will sadly have the opportunity to deliver bad news. Those of you who go into gynecology and OBGYN, you'll deliver good news. You'll bring life into the world. Many of you will put hands on people before they die. You have to have a vision of being a servant. You serve those people in the good and in the bad. And then lastly, I love the word agape. It's a Greek word. It's one of the several Greek words that means love. But it basically means you wish good for all people. Whether you like a person or you don't like a person, whether you like the person in front of you, whether you have the same political views or the same religion or the same anything in front of you, you wish the best for them. When you put on the mantle of doctor, when you put on the white coat, what you do is you become a servant. You listen with your heart. You have a vision of being a servant. And you wish the best for all mankind. We have a great group of people here. You need to be a sponge in the next 3 days. You need to suck all the material out of them that you possibly can. Not only medical knowledge, but these are good people, and you need to understand their heart and why they sit in this chair and why they flew 7,000 miles to be here. Okay? Have a great conference.
Giving us a hint of reality. Thank you so much for that advice.
It is my great pleasure to welcome you all to the third Medical International HMI Conference. To begin with, I want to thank the Almighty God for making this day possible. I want to welcome all our eminent facilitators, our teachers, who have traveled more than 1,000 miles from the United States to share their immense knowledge and vast experience with us. I also want to welcome our distinguished guest of honor from Ibarra-Franklin National Medical University, the deans, the doctors, and the teachers present here today. And of course, our dear students and participants from various cities across Ukraine. With the theme of the conference being becoming a great physician, a mentor factor. One of the greatest values of mentors is that mentors give you direction, they give you perspective, they also empower you to see a positive future, and also that it can be obtained. In the Holy Bible, the book of Proverbs, chapter 1, verse 5, it says, a wise man will hear and increase in learning, and a man of understanding will acquire wise counsel. Today, and for the next couple of days, we have this great opportunity to be guided, to be coached, and by these experienced physicians. As I conclude, I hope this 4-day conference will help the students to expand their mental horizon, to create connections, and to acquire better skills for their future careers. Once again, I want to welcome you all. May I wish everyone a successful conference. Thank you.
Good evening, everyone. Okay, so am I clear to everyone? Yes. All right. So I'm told to say what are the achievements in last 2 years of HMI. Now, last year, in last conference actually, we were 14 from Ternopil. Now this year, how many are we? 15. Can you clap? So, this itself is an example of what we are achieving as HMI. I will be telling you a brief history how HMI started. A medical student like me and you in 2007 took an initiative to do and to bring change for the people of his motherland. Who's that? Dr. Emmanuel Nemo. Yes? He was a medical student at that time, but after he graduated, due to his gradual efforts, he converted his initiative into an organization, which is now an international organization, and you call it as Help Motherland International. Yes? And for now, right now, we have... Alright, you must smile looking at me. That's good. Alright. So... It started from Ghana, yes? Now we have our wings in USA. In Ukraine, we have our wings in many cities. The Ivano, Ternopil, Dnipro, Kyiv and Lviv, right? And there are some coming soon countries and cities as well. HMI India, my friends are working on that. Being connected HMI UK and HMI Germany are also in coming soon list. Work for HMI Kenya has been started. Yes. So I have made some notes for my memory here. Alright, what HMI does? It brings hundreds of medical students like me and you on the same platform for the holistic development. What we do every month, not every month, in the whole year we conduct several clinical seminars, clinical workshops, right? So that students like me and you can refine their clinical skills and we can serve in our motherland, in our home countries. That is what HMI is doing. We are bringing hundreds of students like me and you on the same platform. Yes? So you all are HMI, right? Good morning, HMI. Sorry?
Good evening.
Good evening, HMI. Yes. Okay. Not only this, now we have reached a level where we are conducting a large budget international conference, that is International Medical Conference, and you are part of it today, tomorrow, day after tomorrow, and day after tomorrow. Yes? Okay. And specifically in Ukraine, we have presence in Ternopil, and we went to each of them, after demonstration of practical skills, we went to each of them for judging their clinical skills. And based on that, we provided, and we will be providing further as well, the Student of the Day title. Yes, and we have our first Student of the Day of first seminar right here, and not only this, we have provided them rewards such as waiver in the conference fees, okay, and there will be certain rewards in upcoming time of the whole year. So I want to welcome Mahima Jalpure. And I will recommend every coordinator to bring such initiatives so that students can be be involved in these things more actively, it will not only refine their skills, please listen to me. It will not only refine their skills, it will bring into them a sense of competition, which will definitely be enhancing their learning. And I want to welcome Dr. S. Glanberg, who is surgeon, cosmetic. To our first student of the day.
Good evening once again. Good evening. Alright, so yes, I'm not that funny. Alright, so I'll just do my own stuff. Alright, so I'm here to talk about HMI care. So come before my coordinator last year, but then the past immediate executive does bidding, unfortunately, it's not very available, but then we do stand in some guys. So let's remember to remind him in prayers. Okay. Now, we had the honor to host HMI Team USA on Monday and Tuesday, but I do learn a lot out of it. Trust me. The latest time spent together with them. Come on, guys. I wish you all understand how HMI works. Trust me. I'm not gonna talk a lot, but then I wish this conference is success and you're gonna learn a lot from me. Thank you.
A wonderful strategy.
Thank you, dear Philip. Dear colleagues, dear students, dear friends, hello to everyone. You know, a few days ago, I've just ended reading some series of books written by Stephen King, Dark Tower. Actually, there are numerous moments which I love, but one I will rephrase a little bit. I hope Stephen won't be mad on me. I do not speak with my lips and my mouth. He who speaks with his lips and his mouth forgets the face of his father. I speak with my heart. Why I started from this? Actually, I prepared official speech. It's like a lot of words here, but usually they are more official, a little bit dry. They're not too false, but they're not from heart. Today, I want to start. First of all, I want to start from understanding, and still, right now, I'm really impressed, and I really don't believe that so many doctors crossed thousands of miles, kilometers, they crossed the ocean to come here to Ivano-Frankivsk to meet all of us, all of you guys. Just imagine, how many of you really, just answer for yourself, would cross the ocean just to visit another students to say hello and share like some knowledge? Really? I believe that you may say that you already did it because you're in foreign country, you are studying here, but still it's mostly for your own good. Like you are going to go back to help your motherland. But still imagine, this great team, great facilitators came here to share their knowledge, their passion with us. So please, I just want to make hands for them. Thank you. The next moment which I wanted to pay your attention is that the topic of our this year conference is Become a Great Physician Mentors Factor. Each of us, through all our life, has some mentors. For most of us, the first of them were our parents. They guided us from our childhood and they are trying to keep us right now. But don't forget that our patients, and we should always serve our patients, but still in difficult situations when the patients don't know what to do, we are going to be their mentors. We need to help them to understand, to show them the direction which they need to choose to survive sometimes, to get healed, and so on and so forth. So the main idea for me, for this conference, is let us be good mentors for our patients. Let us guide them well. Let us share our knowledge with them. And again, sorry, Stephen, those who are treating his patient with the tablets and injections forget the face of his father. But I treat my patient with my heart. Thank you.
Of our appreciation for Dr. Gary Jenkins and how much we honor you. We know that you've received the award already. We just want to recognize it. So we'd like you to please come up while we present you the third token of Thank you so much.
They're here kind of as mentors. If you see any of them standing around, not being occupied by another student, it's your job to keep them occupied. I want them so tired that they'll just say, strap me to the wing of the plane and get me home, okay? So it's your job to work them very, very hard, okay? You can't do it, okay? Can you do that?
Yes.
Yes, you can. Okay, so we got some new members and we've got some old members. I mean, they've been here before. So I'm gonna start out with John Durham.
I'm John Durham, and I've been coming to Ukraine for almost 25 years. I'm starting my 6th week here in Ivano-Frankivsk. I'm almost a resident. So if you see me walking on the street, be sure to speak to me. I'm not a doctor, but I was a project manager for 35 years with AT&T Telephone Company. And I'll be talking about communications. Actually, my lecture could probably be done in 15 or 20 seconds. I can tell you everything you need to know about negotiations with one orange. One orange comes off of a tree. I'm going to show you how to use an orange to get along with everybody from customs to your worst patient. Okay, and I love being here with you. This is my 3rd year here, and I probably spent over 2 years living in and around Ivano-Frankivsk, and I just love being here with you. Thank you.
Bucks fan.
Okay, how many of you were in my master class last year? Who can tell me one thing that I emphasized during the class? Surgery is fun. We're going to have fun. It's the funnest specialty. Sorry, ladies and gentlemen. Tell me this, one of the second, maybe it's the first, but also the second important thing that we talked about that I emphasized. Surgery's fun, and we want to look good in the operating room for the nurses. Yes, good. I've already expired by Dr. Jergens.
That's why you wear a mask, right?
That was a good one. He's taking this professorship too seriously. Okay, this year we're going to actually take it up a notch, take it to the next level in approaching the surgery master class. And we're going to do this from 2 complementary aspects. We're going to talk about hard skills. We're going to talk about soft skills. Most associate the hard skills with surgeons. What you do with your hands, cutting, sewing, taking out. Those are the things that are easy for people to judge you by. But we're also going to emphasize things that perhaps you hadn't associated with surgeons, but surgeons should be associated with. And that's the soft skills. Things that have to do with compassion and empathy in communicating. So we're going to really do these in a way so that you, as somebody who thinks of a surgeon, would be able to have a surgeon also be a good physician, because surgeons need to be physicians first. So you can develop as a surgeon hard skills, learn how to use your hands, learn how to cut and sew, and you can impress the nurses, and you can impress your peers, and you can impress yourself. But it's the soft skills, it's empathy, it's compassion, it's communication. Those are the skills that will impress your patients. And those are the skills that will be much longer lasting. And I hope to be able to help you incorporate those into your skills as well. So we're still going to have fun, but we're going to take it up a notch. Now, in addition, I have a special treat for you. On Saturday, I'm going to talk about connections. A couple people have already talked about connections. So Saturday morning, we're going to venture to the past and we're going to venture to the future and help you understand about connections that you probably never realized that you have. So, a second special treat for you. And I have to admit, a special treat for me. We have someone who's going to join me in co-instructing for our surgery masterclass this year, Emily Mays. But have Emily come up and let Emily tell you a little bit about herself and what her thoughts are about being here.
Hi everyone. I'm Emily. I am in my last year of medical school in the U.S. And so I am fortunate enough to join these positions and get to be here in Ukraine. Like Dr. Glenn said, I'm going to help out and help with some of the surgical skills instruction, help with knot tying and suturing. And then hopefully I can also share a little bit about the perspective of a learner in the operating room, because it's a pretty unique experience, and kind of set you all up for success and how to be the best learner you can be in the operating room and medical school in general. And then also I'm just excited to learn from you guys too. You guys have so much experience and kind of have different things than I do, so I'm excited to connect with you all, and please find me in the breaks and please talk to me and ask me all the questions about med school in the U.S., because I'm happy to share what I've learned in the last few years in med school. Thank
you. Emily's mother, Rachel Mace.
Welcome, everyone.
Thank you.
I'm Dr. Rachel. I'm a pediatrician. I've been practicing pediatrics for more than 30 years. And I love what I do. I'm also a mom. So, maybe one of the things we can talk about is work-life balance a little bit.
Yes.
How do you... And Emily might say, what balance? Hopefully not. I'm very excited to be here. This is my first time to come to Ukraine. My first time to be here, and my first time to participate in an HMI medical conference. So this is a new experience for me, and I'm very happy and excited to be here. During our pediatric small group sessions, I would like to talk to you about checkups, well child care, because it's a really important part of helping people be healthy. We want to get them off to a good start. I am going to spend a little time talking about immunizations, because no matter what field of medicine you choose, I think we collectively all have a responsibility to understand vaccinations and to be good role models there. So I'd like to talk about immunizations a little bit. And then I'm going to try to introduce or strengthen for you some practical skills on how to examine children. they really are not scary. And I hope you'll learn a little bit about that. I want you to see that taking care of children is fun. It's a lot of fun. It's the most fun.
No.
Children are not scary. They are fun. And it's very rewarding to be involved in the medical care of children. I also have some cases maybe I can quiz you about. And if time allows during our small group session, I brought a couple of otoscopes because, you know, ear exams and ear infections are such a big part of pediatrics. You can practice examining one another's ears, and I'm happy to help you with that in case that would be fun. My hope, though, what I really hope most of all throughout the sessions that we're here, maybe comes back to a theme that's been already mentioned a couple of times. I would like to talk with you a little bit about the art, or indeed the heart, of being a pediatrician and being a physician of any sort. And the heart of being a physician is the relationships that we build, just as we're building relationships here now. The relationships that we build as physicians are really the most important part of what we do. The relationship we have as a physician with our patient, in pediatrics especially, the relationship we have with the patient's family is very important. The relationship we have with our staff members, our colleagues, and all of the people around us who help us do our jobs is really important, and it is the heart of what we do. For some of us, the relationships are going to have to be established really fast. If you are in an emergency situation or you're about to perform a procedure on a patient, you've got to establish a trusting relationship with a person within minutes. And for others of us, those relationships come over time, maybe multiple visits or even over many years. You'll develop that trusting and long-term relationship with your patients. But it's those relationships, I think, that matter the most and make our work the most rewarding. So I hope that we will develop strong relationships. I can tell you already, I feel your heart. I feel your warmth. I see your smiles. I see the way that you are welcoming all of us, and I'm excited to be here. I just want to say thank you all for being here.
I'm going to talk about the importance of pediatrics as a great specialty. So I'm a pediatric pulmonologist, a pediatric lung doctor. And my route here is a little bit different. In March of last year, when the conference was supposed to happen and the world shut down because of COVID, my son found out that he was assigned to serve a mission, do missionary service in Ukraine for 2 years. And Rachel had said she was coming, and she said, you know, you really need to be involved. And his trip to Ukraine was delayed. He's currently in Nikolov, is that the right town? Nikolov, Ukraine, so he's serving there. But that same son, I haven't even told Gary this story, that same son, you know, he was, I don't know if you guys were all great drivers, but he was not the best drivers. He got into several wrecks when he was in high school, so bad that my insurance agent, Mike Bates, dropped me from his insurance policy. And in that conversation where he dropped the insurance policy, he told me about his good friend Gary Jerkins, my former good friend Gary Jerkins. And he told me about Gary and the service here. And so I was thrilled to be able to come. I want to tell, while I was sitting here thinking about just one story I could tell, I want to tell you a story that's actually not related to a lung issue directly. About 8 years ago, I was seen in church, and there was a family sitting in front of me. They had just moved into our area. They were sitting in front of me, and they had their baby. And the wife found out I was a doctor at Vanderbilt, and she started asking me a question. And she pointed out that her child, for about a few months, had sort of this irritation on their ear. They'd been to the pediatrician. You know, they treated it with antibiotics on multiple occasions, and it hadn't gotten better. And she just didn't know what it was, and it was just sort of like this little growth in the child's ear. 2 weeks earlier, I'd had a patient transferred in from about 200 miles outside of Nashville, so pretty far for our referral center, had gotten transferred in with this disease that I'd actually never heard of. We did a bronchoscope, And when we did the procedure, his airway kept collapsing. And it turned out he had this disease, this antibodies that attack the cartilage. It's called relapsing polychondritis. I'll admit, a disease I had never heard of. But I ended up giving a lecture on that disease to the residents at our institution. And as part of that lecture, I learned that there's also can develop effects on the cartilage in the ear. And that it's oftentimes the diagnosis of that is delayed for 6 to 12 months because it's not clear what it is. So I'm sitting in church, I'm sitting behind this family, and this mother asked me, you know, what do I think? And I said, you know, I'm going out on a wild, you know, just on a limb here, but I think your child may have this disease. Never heard of it until 2 weeks ago, made a referral to the specialist, and it turns out that's what he had, and it transformed his life. The reason I tell that story is that even if you're going into orthopedics or cardiology or urology or maybe even surgery, no matter what you're going into, you're going to find value in the different presentations today. And I promise you all have here have chosen a really special, a divine profession, right? Being in healthcare, being a physician, to me, is just the greatest blessing. It's that blessing where patients share things with you. But as a pediatrician, parents put their child in your care, and they expect the most of you. And so I promise you, wherever you end up, whatever career, I hope as you just listen to the different talks today, this weekend, that you'll be inspired and you'll think about what are the things that are going to change me? How can I be a physician that makes a difference in the lives of my patients? Anyway, thanks for letting me be here.
To be here again. I love Ukraine. I love you guys. I love to see your enthusiasm and your creativity and your intelligence. I love to be here. I'm an anesthesiologist and have been for, I'll adopt your saying, more than 30 years. I would like to say that everything good in my life is due to Jesus Christ, and the rest is all my responsibility. But along those lines, I deal with breath, and I would like, as in the words of the last verse in Psalms in the Old Testament, let everything that has breath praise the Lord. So in the interest of that, I deal with that, and I want to help you deal with that. You may think I'm never going to deal with that. Just wait till somebody brings their parent to your waiting room, and you will see that you may. And I don't want you to be anxious. Jesus told us we couldn't add 18 inches to our life by worrying or being anxious. And I assume that means I can't add 18 inches to someone else's life by being anxious. So I want you to be comfortable with an airway. So I'm going to talk about airways, and I'm going to talk about mask ventilation. And pretty much, if you can do that, you can temporize until someone else can come. We're going to talk about more items for those that are more interested in going further. Laryngeal mask airways, direct laryngoscopy, which is the gold standard of what everybody wants to be able to try. Now we have video, laryngoscope, so it really isn't as important anymore to know all the tricks, but we still want to know and be able to do it to be the real deal. And emergency brachydactyly. You want to be able to do that because anytime something could cause you to be there. And I want to talk about one more thing just very shortly. As a physician, you will be privileged to be there at one of those important moments in life, which is death. You'll be there when it's very close and you're dealing with an airway. And sometimes you'll have an opportunity to talk about death and dying to someone who's never thought about it, and all of a sudden it's right in front of you. So thank you for listening, and I look forward to having you in my class, and thank you for having me.
Yeah. My britches rolled up. Try not to wear a belt on the airline, so I didn't take it off. Yeah. Anyway, I'm Melissa Davis. I have been in another country, and for soldiers. I was in Operation Desert Storm. None of you were alive at that time, I don't think. But anyway, that was a wonderful opportunity. I've been able to give anesthesia for that many years, and I have a lot of stories. It occurred to me that my grandmother, we grew up on a farm. My grandmother was Tyson, a big chicken company before there were big chicken companies, but she wanted to keep the farm in the family. She had 3,000 chickens. Wow. And we kill 100 of them a week. Wow. And she would put the chickens, there's a humane way to do that. And so we would hang them up and they would get real sleepy, and then we would kill them. And, and we would do all the things that you have to do to prepare the chicken. But the one thing that she did for me, which the reason I'm standing here today, she went through every chicken. Oh, look at this. This chicken wouldn't have lived anyway. Its heart's got a lot of fat on it. She showed me the heart, she showed me the lungs, she showed me the liver. We went through every chicken. It was so fascinating. I had been doing anesthesia for 15 years, and it was late one night, and we were trying to find what was wrong with this guy's bowel, and I'm thinking, this is like chickens. I have been able to do the things I love the most at 4 or 5 years old. You know, I'm back and, seeing running the guts and knowing what has happened to this person from the chicken time. I'm doing trauma and triage here. I think I went to the Army, was in the war, and I was at a level 1 trauma center, and so I've had opportunity to see a lot of bad things, and I think we all have to be prepared for that. One thing I hope that students that I talk to can take away is I learned a lot of chemistry and biology, and I learned all the things that you're supposed to do, and all the rules you have to go by, and I tried to make better on them because I want it to be logical. I want it to be, you got to think, because some things are not in the book. Some things are, some things are not in the book. And now I would like to take the opportunity to thank Dr. Cobb. We give him a hard time about a lot of things, but he's the reason I'm here. He said 3 years ago, you need to go to Ukraine. You need to go, and he had been here, he loved it, and he was telling me all about it, and I thought, what? I don't even know where that is, and I don't think I could do any good at all. I don't know that I could do any of that. And I thought it over and prayed about it and thought about it, and I thought, if somebody thinks that I can help somebody, if somebody else thinks that I have a talent to do that, then maybe I should go with it. And people see things in you that you don't see, and I see a lot of things here. You all have such bright eyes, and you all are so interested. I can tell that for sure. So I want to thank Dr. Cobb for giving me this opportunity.
Thank you for allowing me to be here. This is my second HMI International event that I've been able to come to. I've been in practice as a dentist for 43 years.
Wow.
And don't worry, I'm not going to turn you into dentist. Our class is oral health, and what my objective is to help draw the line between medicine and dentistry so that you understand things that are going on that maybe you're not really paying attention to that much as far as intraoral as well as extraoral. And so we're going to cover infection, pathology, what's normal, what's not normal. We want to make it interesting. We don't want to turn it into a lecture class like maybe you've had to sit through and listen. That's important, but I want to give you some practical things that you can use as you go through your daily practice and exams and that sort of thing. So thank you again very much for the opportunity, and look forward to seeing you in class.
You know, every time I went on one of these trips, I came back and I would sit on the plane and I would write down a list of 2 or 3 people, and in my mind they had a target on them. I need them to go. Some of you will remember Dr. Ron Swang. Yeah. I had a target on Dr. Swang many years ago. He came, he sends his greetings to those of you that know him. And I came back with the idea that the first time that they even had the idea of a conference, and I thought, I need Mark Cobb to come on this trip. And so I sat down with Mark and his wife, Lydia, in our home, and for about 3 hours, this man takes some convincing, I will tell you. And so for about 3 hours, we sat there, and I thought, there's no way he's going to go on this trip. There's no way on earth. So about 2 or 3 weeks later, you have to understand, prior to being a neurosurgeon, he is a mathematician. Ooh. Yeah. So I get a call from him, or I talk to him, and he says, well, I think I am 94% sure I'm going. And I think, who on God's earth says I'm 94%? It's like, you know, I'm 50%, I'm 90%, but no, Dr. Cobb was 94% ready to come. I will tell you this, I will trust this man, I will trust any of these people with my life. He operated on my back in December the 21st for 4 hours. It still hurts here. More drugs. So anyway, one other thing that you don't know about him, it's been unveiled on this trip. You all have directors. Yesterday, Dr. Mark Cobb was elected the director of HMI USA Entertainment. And it's a really special honor, and he is putting together a, well, it's going to be special, I will just tell you that. Okay, Dr. Mark Cobb.
All right, can you guys hear me back there? Yes. That group right back there, is he entertaining? And you guys said no, right? They have been doing this to me since I first got here. We are not doing a director of, I can't sing, I can't dance, I can't play an instrument. I've got like no creativity whatsoever.
Amen.
That's right. And on top of all of that, I just absolutely hate standing in front of everybody. Class is going to be great, but this is terrible. And I've talked with a lot of you. A lot of you guys know this already. You get up there and what happens? Your heart starts beating fast, and your palms get sweaty, and your mouth gets dry, and the world starts fading out. Why? You think you're just going to pass out? I have never liked it. I don't like it now. And some of you know this very well. I just can't imagine when people stand up and talk so fluidly and feel so comfortable. It's painful. It's painful every time. But you have to. So sometimes you just have to do painful things. So I'm a neurosurgeon. And that means I take care of people that need operations on the nervous system. Now, everybody has a nervous system. You know, sometimes you have brain, some of you wonder, but you have brain, spinal cord, and peripheral nerves. And it needs to be working well. I mean, that just needs to be working for you to be you and to have the life you need to have. And unfortunately, there are a large number of diseases and conditions and problems and injuries that impair the nervous system. Fortunately, the majority of those don't need an operation, and so that's good. But they do need appropriate treatment. That means they need a diagnosis and appropriate care. And if your trajectory, your journey in medicine takes you to neurosurgery or to neurology, you'll be the doctors that administer those care. But if not, it's still very important that you have a basic ability to recognize some of these problems. So every physician should have the ability to do a basic, simple, bedside neurologic exam. And in my master class, that's what we're going to do. We're all going to practice exactly that, a basic neurologic exam. For some of you, it will be brand new, maybe perhaps most of you. For others, it might be a review or refresher. But hopefully, for everybody, it'll be useful and perhaps a little bit fun as well. I'm very much looking forward to having you all in class in there. So.
Thank you.
Hi, I'm David. I don't have a medical degree. I'm just fortunate that I graduated college at all, so I'm happy for that part of it. But what I do have is a passion for telling stories. Let me get here with the camera before I'm in the shot. Am I in the shot now? Okay. Because behind the pillar doesn't work, does it? What I do have is a passion for storytelling and with video cameras and images and sounds and things of that sort. I've been doing that for, gosh, 40 years, I guess, or more. But I love doing it, and it just brings me around to saying that all of you have a story worth telling that, that has value to it, and you're writing your own story right now. And you have a lot of collaborators in that story. All the people here, and these people here, and this man here. So I'm hoping that you can appreciate and understand that, because part of what I'm doing here is helping to tell the story of this group and to tell your story as well.
Mental factor. It is very, 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 very important that you have a mentor in life. You know, when you look at the Bible, it has a whole lot of scriptures talking about mentorship. And even in the book of Proverbs, there are so many numerous scriptures that are like.
You took exams, you flew a long way to get here, you followed rules and regulations. So let me talk a little bit about respect. These people flew a long way, they put a lot of time and effort into it. Being on time is not an option. Being on time, if you're on time tomorrow, you're late, okay? If you're on time tomorrow, you're late. I'm a surgeon, Mark's a surgeon. Glenn, you a surgeon? Glenn was a surgeon. Let me tell you what, we boarded a case. If we started at 7 o'clock, the patient was there, the staff was there. If they were waiting for the doctor, that's not a doctor I want to be waiting on, okay? Not a surgeon want to. You're going to be doctors. Your patient's going to want you to respect their time. You respect our time. You be on time. We will close that door. We love you, but we will leave you outside, okay? And let me tell you what, if you're late for Dr. Cobb's class, you don't want to hear what happens. And you think I'm kidding. So I don't say that in a bad way, but that's respect. That's respect for us, that's respect for each other. Tomorrow will be confusing. We'll try to have people planted so we're finding places to go. All the classes are on the 5th floor and the 4th floor, okay? So we'll have people pointing in certain directions. So just get there. At the breaks, this is always where everybody messes up. That's on the 6th floor. You're gonna have 15 minutes. Get up there, get down there. All the food stays on the 6th floor. We are guests in the hotel. So what's that about? Respect. We're gonna leave this place better than what we found it, okay? I know I sound like a parent, because I am a parent. It's just the way it is, kind of things. But be on time, have a good time. As I said, don't let any of these people have any free time to themselves, okay? And you got to get a Melissa story, which is no doubt about that, for sure. Have a great time, Dr. Tommy. Anything else we need to do? Ladies, anything else to do? I'm done. Be on